All right, so this next one is going to be a bit of a doozy. I've been kind of procrastinating it a little bit because it seems like a daunting task to do. It's probably not going to be just one video. It's probably going to be cut into maybe at least two or three. We'll see how well it goes. So this is going to be the timeline of all of the events that are happening in the heart within less than a second. Okay. You see, I'm going from 0 seconds all the way to 0.8 seconds. It's not entirely important for you to know what second every event is happening, but what you do want to understand is you want to know what's happening on your ECG at each portion of the cardiac cycle, okay? Why do you need to know this? Well, it's important so that you can understand when you evaluate your ECG back here, you also understand what's going on with the heart and why it's problematic if your ECG is not normal. Because you can help figure out then, oh, my patient, this is what this is the reason why my patient is having these specific symptoms. It goes back to, okay, this is why this is because the heart's not working properly, okay? So we're going to get started with going over the cardiac cycle and then putting it on our ECG, okay? So there are essentially kind of 5 events in the cardiac cycle. It sort of depends on what book you read. You can see in this cardiac cycle image, it has 4 phases, 1, 2, 3, 4, and then it starts over at 1. In the other book that I'm using, in terms of their diagrams, it actually breaks it down into 5 phases. And really, it's breaking it down into 5 phases because they broke phase 1 kind of into 2, in my opinion. Okay. So we're going to start here at number 1. This is atrial contraction and ventricular filling. So phase 1 is happening right here at the P wave, right? We did this, like this whole thing is basically one cardiac cycle where we have a P wave, right? We have our QRS here, our QRS complex. And then here we have our T wave. So above, I'll put T wave. I'm sorry, P wave, P wave. So that I can write some stuff down, whoops, at the bottom instead, near my cardiac cycle pictures. I put my cardiac cycle pictures on here to save myself some time in terms of drawing stuff. So it wouldn't be as long as how long it took me to go over this in office hours. Okay. So we're going to start at atrial contraction and ventricular filling. So what happened previously in our 5th phase here is atrial relaxation and ventricular filling. So you want to understand, if we go backwards in this flatline area, and that flatline area is basically the P to T interval, right? It's actually this part right here that sometimes people don't exactly label, but that part right there is the P to T interval. Okay. So in our P to T interval, essentially, this is going to be atrial relaxation and ventricular filling. In this case, blood is going to be entering from our veins into the right and left atria simultaneously. And because we have atrial relaxation, our AV valve here should be open. What's happening electrically? Nothing. Nothing's happening electrically, excuse me, electrically in the heart. The heart is going through repolarization. It's going back to its normal stage. It has to go through relaxation at this time. But in this case, our AV valve is open. Our semilunar valves close. Okay. Yes, we have atrial relaxation and ventricular filling. I'm not going to write that because it's literally in the phase's name right there. Okay. Here you also want to think about like pressure. Pressure is going to help you understand how blood moves from one place to another place. In this case, we're going to see that atrial pressure is going to start to increase. It's not increasing a whole lot, but it's increasing because you're filling each of your atria. And then again, blood is moving passively into the ventricles and it's filling the ventricles, okay? Then what's going to happen is the next beginning of the cardiac cycle has to occur, and that's atrial contraction and ventricular filling. So what we're going to remember is this is right around the P wave, so we have to remember the SA node depolarizes, right? And as the SA node depolarized, we have atrial contraction. Because of atrial contraction, we have atrial pressure going way up. So in this case, atrial pressure is greater than ventricular pressure, and a little bit more like arterial pressure, basically the pressure in the arteries is always going to be is always high. Okay, so let's kind of just think about atrial pressure, ventricular pressure, or arterial pressure whenever they're the highest. So as a result of atrial pressure being high, AV valves remain open. Okay, in this case, yes, arterial pressure is high, so technically you still have a little bit of blood in the artery here. So that means our semilunar valves are still closed because that atrial pressure, the arterial pressure is higher, okay? So we're gonna fill the ventricles. You see how as we contract the atria, blood is gonna squish all the way into the ventricles, filling the ventricles completely, okay? That's what's happening during the P wave. And then remember, we're gonna have this P to R segment, right? We're gonna have this P to R segment. And in the P to R segment right here, I don't have like a great, sorry, I had to like hand make this chart in PowerPoint, and it's not actually easy to make lines in PowerPoint sometimes. But in this P to R segment, remember, this is our delay in our atrial ventricular node depolarizing. And that's going to allow for continual atrial contraction, okay? So then the next thing that's going to happen is we're going to have isovolumetric contraction. So remember, isovolumetric, iso meant same, so isovolumetric means same volume contraction. In this case, we're going to start to contract the ventricles, and I wish these little lines weren't there. We're going to start to contract the ventricle in the interventricular septum. So in this case, this is where our QRS is going to start, okay? So that is going to be QRS. It's going to be isovolumetric contraction. Here, our AV node to our AV bundle are all going to contract. Like everything down the interventricular septum is going to contract. So AV node to AV bundle, and then we start to contract bundle branches. As this occurs, obviously we have ventricular contraction. Okay, the ventricles start to contract, and as the ventricles contract, ventricular pressure increases. Sorry about my handwriting. Even though this slide is rather large, it was still not big enough to fit everything on here. Let's see if I can write it in black. So ventricular pressure, I'm just going to abbreviate, increases. Okay, so as ventricular pressure increases, you can see what happens. Our AV valves close. I should say AV valves. And the semilunar valves are closed. Okay, why are the semilunar valves closed? The semilunar valves are closed because you actually still have blood a high amount of blood in the arteries all the time. And remember, arterial pressure or pressure in the arteries is always higher than in the heart. So those AV valves usually have to be closed most of the time, okay? So AV valves are closed, semilunar valves are going to be closed, and essentially what we see is as pressure builds, okay, this is what's going to allow for us to start to eject blood out of the heart, okay? Don't forget here, atrial relaxation. So the atria are relaxing at this time as well, okay? Then what we're going to see is that we're going to have our next part, and then next part is really going to be in this S to T portion. So here we have this kind of flat line S to T segment. Whoops, okay. We'll see if I could do this in one short-ish video. And again, my segments are not very good. That should be a little bit flatter. This should be my S to T segment. Okay, so in the S to T segment, you really have ventricular ejection right here. What that means is my bundle branches to my Purkinje fibers depolarize. Okay, and as that depolarization happens, my ventricle contracts. And as my ventricle contracts more, my pressure increases. Because essentially you're contracting, remember, you're contracting this outer wall. My AV valves are still closed. They have to be, right? If they're not closed, then blood's going to push backwards into the atria. So my atrioventricular valves have to close in this case, but my semilunar valves are now being pushed against because my blood that's in my ventricles has only one direction to go, and that's up now towards those valves. So my semilunar valves open in this case, and as those semilunar valves open, blood ejects out of the ventricles into the arteries. That's why it's called ventricular ejection. Okay. Then this next like high portion here, the T wave essentially is isovolumetric relaxation right here. So why is there this peak? Remember, because you're going to start to repolarize at the apex. Okay. So that means what's happening here is we have repolarization here, and then that repolarization spreads upwards. Let me make that maybe in green. So my heart is still electrically charged because I'm still kind of doing some ejection up at the top here. This is going to be a much slower process in order to repolarize the entire heart, essentially. So as my repolarization at the apex happens, my Purkinje fibers start to go through repolarization. And what we're going to see is I'm going to have isovolumetric relaxation, which is same volume of blood here in the ventricles, but really in the arteries as well. So I'm going to have ventricular relaxation and atrial filling. Okay. It's just kind of weird because they call this atrial relaxation, and then like atrial relaxation and ventricular filling. Then you have atrial contractions. So it's kind of weird how they're doing isovolumetric relaxation. Because during isovolumetric relaxation, the atria are going to start to fill with blood. The AV valves are closed. And the semilunar valves are closed. Okay, hopefully you understand why. Because here, in this case, artery pressure is highest. So because we just moved blood into the artery, as that blood increases the volume and your heart's going to start to relax, blood's going to start to flow backwards in a suction effect. And you're going to close off those semilunar valves so the pressure remains high in the artery and you can move blood forward. Okay. And because you have a little bit of that suction effect, you can start to fill the atria again, right? The right and left atria with blood start to fill. Because you have that relaxation, you haven't completely relaxed everything yet. The AV valves are still closed, allowing for atrial filling, and the ventricle starts to relax. So this is when you start the whole process over again and you have atrial relaxation and ventricular filling. Okay, at this point, you now have higher pressure. Again, you increase, right? We're going to increase arterial pressure here. I'm sorry, we increase atrial pressure. And that opens our semilunar valves. I'm sorry, that opens our AV valves. Okay, as we open our AV valves, we have ventricular filling, and you would basically start the cardiac cycle over again. So this is one cardiac cycle. Remember, a cardiac cycle is all the events in one heartbeat. Okay, you can look at this graph too. This graph is basically the same timeline that I made, except for I just kind of wrote stuff out instead. Here in phase 1, you have ventricular filling and atrial contraction. You see my AV valves are open, my semilunar valves are closed. What you should see here is the purple. This is the atria pressure increasing right there because of the contraction. And as that the atria contract, what you see is you have ventricular filling. So my volume in the ventricle increases. And that's essentially going to cause my pressure to increase in my ventricles right there. As my pressure increases in my ventricles, my semilunar valves, my atrioventricular valves close right here. Okay, so this area right here is isovolumetric contraction. So my semilunar valves close, my atrioventricular valves close, pressure in my ventricle increases, and that's going to cause my semilunar valves to open, and that's going to drop ventricular volume because I have ventricular ejection. Oh, ventricular ejection right there, right? So as my ventricular ejection occurs and my volume in my ventricle decreases, you can see how ventricular volume decreases and atrial volume also is decreasing because this is all relaxation at this time, okay? As I have ventricular ejection, what you're going to see in the blue is that, yes, atrial pressure starts to increase, dips a little bit, and then increases and comes back down again. Why does it go back down again? Is because that blood is moving away from like the beginning part of the aorta and the pulmonary trunk. But you should notice how aortic pressure is always high, right? It's always like 110 over 70, 120 over 80. This is normal BP, which is 120 over 80, something like that. That's why aortic pressure or pressure in the arteries is always high, because it's always high. It's just how it is in order to drive the forward movement of blood. So when you look at the EKG down here, again, you can see that the P wave right there, the P wave is happening in atrial contraction. You can see that the QRS complex is happening during isovolumetric relaxation. And then you can see ventricular ejection right there is where my S to T interval is, or segment, my S to T segment is. And then my T wave is right here during isovolumetric relaxation primarily, right? So isovolumetric relaxation is this little time period here. When ventricular pressure drops, atrial pressure starts to increase slightly because we're starting to do atrial filling again. All 4 of my valves are closed, and then I start to do my ventricular filling because my atria have filled all the way. You start to move blood again into the ventricles, so you have to open the semilunar valves again. You start the whole cycle over again, okay? See that in one electrocardiogram cycle of basically less than a second, you have the whole entire cardiac cycle. So it depends on how you want to study this. You can study it from this chart. You can make a chart like this for yourself, list it all out. It's up to you to determine like what is the best method. I mean, I would use the chart like this, maybe make it a little bit bigger for yourself so you can write everything out. Okay. Hopefully this kind of helped explain what's going on here and all the events in the cardiac cycle all together. That's the whole point, putting everything together here at the end. And what does everything look like as the heart does what it's supposed to do in pulling blood in and pushing blood out?